Medical nanotechnology, revolutionizing the treatment of infectious diseases. Introduction. Medical nanotechnology is an emerging field that combines the disciplines of medicine and nanotechnology to develop innovative approaches for the diagnosis, prevention, and treatment of various diseases, including infectious diseases. By utilizing nanoscale materials and devices, medical nanotechnology offers novel therapeutic strategies that can significantly enhance the effectiveness of current treatments while minimizing adverse side effects. In this comprehensive script, we will explore the latest advancements in medical nanotechnology for the management of infectious diseases. One of the key challenges in treating infectious diseases is ensuring the delivery of therapeutic agents specifically to the affected site while minimizing their distribution to healthy tissues. Nanoparticle-based drug delivery systems have shown great promise in achieving this goal. By surface functionalizing nanoparticles with ligands that specifically target infected cells or tissues, drug molecules can be efficiently delivered to the desired location, enhancing treatment efficacy and minimizing off-target effects. In this paragraph, we will delve into the various surface functionalization strategies employed to target infectious diseases, including the use of antibodies, peptides, and aptamers. Antibiotic resistance has emerged as a major threat in the treatment of infectious diseases. Conventional antibiotics often face limitations in reaching the site of infection or exhibiting poor intracellular penetration. Nanoformulations offer a solution to these challenges by encapsulating antimicrobial agents within nanosized carriers. These carriers provide protection to the drug, enhancing its stability, bioavailability, and targeted delivery to the site of infection. This paragraph will discuss the various types of nanoformulations employed for antimicrobial drug delivery and their potential in combating drug-resistant infections. Early and accurate detection of infectious agents is crucial for effective disease management. Nanosensors have emerged as powerful tools for the rapid and sensitive detection of pathogenic microorganisms and their associated biomarkers. By exploiting the unique properties of nanomaterials, such as high surface area to volume ratio and enhanced sensitivity, nanosensors can detect even minute concentrations of infectious agents in various clinical samples. This paragraph will explore the different types of nanosensors used for infectious diseases diagnosis and their potential applications in point-of-care testing. Vaccination plays a pivotal role in preventing infectious diseases. However, traditional vaccine formulations suffer from limitations such as low immunogenicity and short duration of protection. Nanoparticle-based vaccine delivery systems offer a promising approach to overcome these challenges. By encapsulating antigens or adjuvants within nanoparticles, vaccine formulations can be optimized to enhance immune responses, improve antigen stability, and enable controlled release kinetics. This paragraph will delve into the various nanoparticle-based vaccine platforms and their potential in conferring long-lasting immunity against infectious diseases. Viral infections pose a significant global health threat, with limited treatment options available. Nanotechnology-based approaches provide new avenues for the treatment of viral infections, including strategies to inhibit viral replication, enhance host immune responses, and target viral reservoirs. This paragraph will explore the latest advancements in nanotechnology for the treatment of viral infections, including the use of antiviral nanocarriers, nanostructured viral inhibitors, and targeted siRNA delivery systems. Gene therapy has emerged as a promising strategy for treating infectious diseases by targeting the underlying genetic factors responsible for the infection. Nanotechnology offers unique tools for efficient and targeted gene delivery, enabling the introduction of therapeutic genes or gene silencing agents to infected cells. This paragraph will discuss the role of nanotechnology in gene therapy, including the design and optimization of nanocarriers for gene delivery, as well as recent advancements in the field. Antibiotic resistance has become a major global health crisis, rendering many conventional antibiotics ineffective against bacterial infections. Nanomedicine provides innovative solutions to counteract antibiotic resistance by developing novel antimicrobial agents, such as antimicrobial nanoparticles or nanomaterials with enhanced efficacy against drug-resistant pathogens. This paragraph will delve into the strategies employed by nanomedicine to combat antibiotic resistance and the potential of nanomaterials in the development of new generation antimicrobial agents. Visualization and understanding of infectious disease processes at the nanoscale level are essential for developing effective diagnostic and therapeutic strategies. Nanoscale imaging techniques, such as scanning electron microscopy, atomic force microscopy, and fluorescence imaging, provide unprecedented insights into the interactions between pathogens and host cells, as well as the dynamics of infection. This paragraph will explore the various nanoscale imaging techniques utilized for in-depth study of infectious diseases and their contributions to our understanding of disease pathogenesis. Nanotheranostics represents an integrated approach that combines therapeutic and diagnostic functions within a single nanoscale platform. By incorporating diagnostic imaging agents and therapeutic payloads into a single nanoparticle, nanotheranostics enable real-time monitoring of treatment response and targeted therapy delivery. This paragraph will discuss the potential of nanotheranostics in infectious diseases management, including simultaneous imaging and therapy, theranostic nanocarriers, and personalized medicine approaches. Nature's intricate mechanisms have often served as inspiration for the development of innovative nanomedical technologies. Biomimetic and bio-inspired approaches in nanomedicine aim to replicate or mimic the natural processes occurring in living organisms to enhance treatment efficacy and reduce adverse effects. This paragraph will explore the use of biomimetic and bio-inspired strategies in the design of nanomedicine for infectious diseases, including biomimetic nanostructures, targeted drug delivery systems, and artificial immune systems. The development and translation of nanomedicine for infectious diseases necessitate careful consideration of regulatory and ethical aspects. As nanomedicine continues to progress, it is crucial to evaluate its safety, efficacy, and ethical implications to ensure responsible innovation. This paragraph will discuss the regulatory and ethical considerations involved in the development and commercialization of nanomedicine for infectious diseases, including clinical trials, ethical guidelines, and risk assessment. Infection control in healthcare settings is of paramount importance to prevent the spread of infectious agents. Nanostructured materials, such as antimicrobial coatings and surfaces, offer an innovative approach to inhibit the colonization and growth of pathogens on medical devices, surfaces, and implants. This paragraph will explore the use of nanostructured materials for antimicrobial coatings, including the mechanism of action, fabrication methods, and potential applications in infection control. In conclusion, medical nanotechnology holds immense potential in revolutionizing the diagnosis, prevention, and treatment of infectious diseases. The various topics discussed in this script highlight the significant advancements made in nanomedicine for infectious diseases, ranging from targeted drug delivery systems to nanotheranostics and nanostructured materials for infection control. As this field continues to grow, it is essential to collaborate across disciplines, address regulatory challenges, and ensure ethical considerations to fully harness the transformative power of medical nanotechnology in combating infectious diseases.